I'm having an issue now. It's not telling me that it's recording. 1 second. Record on my computer. Now let's. There.
Okay, good morning. I would like to call the January 21st, 2021 virtual board meeting to order at this time. It is 9 a.m. I will start the meeting this morning with the board's mission statement and philosophy. Mission statement. The mission of the Texas Board of Nursing is to protect and promote the welfare of the people of Texas by ensuring that each person holding a license as a nurse in the state of Texas is competent to practice safely. The board fulfills its mission through the regulation of the practice of nursing and the approval of nursing education programs. This mission, derived from the Nursing Practice Act, supersedes the interest of any individual, the nursing profession, or any special interest group. Acting in accordance, this is our philosophy, acting in accordance with the highest standards of ethics, accountability, efficiency, effectiveness, and openness, the Texas Board of Nursing approaches its mission with a deep sense of purpose and responsibility and affirms that the regulation of nursing is a public and private trust. The board assumes a proactive leadership role in regulating nursing practice and nursing education. The board serves as a catalyst for developing partnerships and promoting collaboration in addressing regulatory issues. The public and nursing community alike can be assured of a balanced and responsible approach to regulation. I would like to welcome all our board members, board staff, and audience this morning to this board meeting. This meeting is being held pursuant to Texas Government Code Section 551.127 and in accordance with the governor's disaster declaration related to the COVID-19 pandemic and his subsequent orders. Before we begin this morning, I would like to remind everyone to please keep their line on mute until they wish to address or speak to the board. And at the time an individual wishes to speak to the board, they should unmute themselves. Then after completing their remarks, should return their line to mute. Please remember to turn off any apps and or email that may be open or running on your devices for the duration of the meeting. Finally, please remember to mute and turn off any cell phones. I would also like to remind everyone that the meeting today is being recorded, and at the same time it is also being sent out through a live link to the board's YouTube channel for the public to be able to observe this meeting today as it takes place. So we will begin the board member roll call. Kathy Thomas will take the roll.
Representing LVN Education, Carol Hawkins.
Good morning, I'm Carol Hawkins. Here. Representing Nursing Education from San Antonio, Texas. I'm sorry. Thank you.
That's okay. Representing RN Practice, Laura Disk.
Present.
Representing RN Practice, Diana Flores. Ms. Flores is absent. Representing Consumers, Maisie Jameson. I believe Ms. Jameson is having some technical issues and will join us as soon as she can. We'll announce it at that time. Representing LVN Practice, Kathy Leader-Horn.
Present.
Representing Baccalaureate Nursing Education, Allison Porter Edwards.
Present.
Representing Associate Degree Nursing Programs, Tamara Rhodes. Ms. Rhodes is absent. Representing Consumers, David Saucedo. Mr. Saucedo will join later in the meeting. Representing Melissa Scott, LVN Practice. I'm sorry, representing LVN Practice, Melissa Scott.
Present.
Representing Advanced Practice Nursing, Kathy Ship.
Present.
Representing Consumers, Francis Stokes.
Francis Stokes, present.
Representing Consumers, Rick Williams.
Rick Williams, present.
Representing LVN Practice, Kim Wright. Ms. Wright, I see you there. You're muted. At the bottom of your screen, there's an unmute button. Okay, we still can't hear you. Would you just raise your hand that you're here? And I recognize that you are. Thank you. Madam President, we have a quorum.
Thank you. Board members and staff, we will proceed now with introductions. So I am Kathy Ship, and I represent APR in practice on the board. Dr. Edwards?
Good morning. My name is Allison Edwards, representing Baccalaureate Education.
Ms. Hawkins?
Good morning, Carol Hawkins, representing Vocational Nursing Education from San Antonio, Texas.
Mr. Stokes?
Good morning, Francis Stokes, representing Consumers from Port Aransas, Texas.
Ms. Lederhorn?
Good morning. I'm Kathy Lederhorn. I represent LVN Practice, and I am from Granbury, Texas, and practice in Fort Worth.
Ms. Wright?
Good morning. Can you hear me?
Yes.
Kim Wright. I'm from Big Spring, Texas, and I represent LVN Practice.
Thank you. Ms. Disk?
Good morning. I'm Laura Disk. I represent RN Practice, and I am from Pharr, Texas.
Thank you. Ms. Scott?
Good morning. This is Melissa Scott, and I represent LVN Practice, and I am from Granbury, Texas.
Thank you. And Mr. Williams?
Good morning. My name is Rick Williams, and I represent Consumers, and I'm from Killeen, Texas.
Thank you. And Ms. Thomas? Well, now we will start with board staff.
Yes, the rest of us in the room are staff, and I'm Catherine Thomas, Executive Director. Dusty?
Good morning, board members. Dusty Johnston, General Counsel for the board.
Mark?
Good morning. Mark Mayak, Director of Operations, Staff.
Kristen?
Good morning. Kristen Benton, Director of Nursing on board staff.
And Tony?
Morning. Anthony Diggs, Director of Enforcement, Board Staff.
And our IT expert, Dan Fletcher. Dan?
I am here.
Okay, great.
Happy to be here.
For the audience, you'll notice that for myself and for Dr. Benton, we both have nurse education as our names at the bottom of our pictures. We haven't fixed that, but it's because we are logged on other applications. So sorry about that. That's all of the staff in the room
no,
at this
Patricia.
time. Oh, Patricia, I'm sorry.
I'm
The
not
most
even
important person
slightly,
in the room.
I'm not even slightly offended by that, Kathy. I was just gonna leave. Patricia Vianis Cabrera, Executive Assistant.
Yeah, and Patricia kind of keeps it all together. So thank you. Thank you very much. We may have a couple of board members that will be coming into the meeting in just a little bit. So board members and staff, let's get started with reviewing the agenda. Are there any changes, corrections, amendments to the full agenda? Ms. Thomas?
Yes, Madam President, staff requests the removal of the following items from the agenda. Agenda item 5.1.2, the quarterly statistical report for the first quarter of fiscal year 2021. And agenda item 8.1, agreed orders, remove the agreed order of Albrecht, ALBRECHT, Sarah Nell, RN license number 948882.
Thank you. Are there any other changes, corrections, amendments to the full agenda? Having two removals from the agenda, agenda item 5.1.2 and under agenda item 8.1, agreed order of Albrecht Sarah Nell, RN number 948882. Dr. Edwards, can I get a motion to approve with the noted removals? Okay, she's having IT issues. Kathy Lederhorn, could you give me a motion, please?
Yes, ma'am. I move to approve the agenda of the January 21st, 2021 board meeting with the removal of agenda items 5.1.2, quarterly statistic report, first quarter fiscal year 2021.
And the agreed order?
Oh, I did not write down that number. I'm so sorry.
Okay, and that's okay. Agreed order Albrecht Sarah Nell, RN number 948882, as stated earlier. So I have a motion, and I need a second.
This is Allison Edwards, and I'll make a second.
Okay, Allison Edwards, second. Thank you. Having a motion and a second to approve the agenda. If no objection from board members, the agenda is approved. This vote is being taken according to Board Policy 2.7, that is Simplified Parliamentary Policy, Rule number 4. So it allows us not to go through for the audience so that we do not have to go through the vote process since we have that in our policy. Board members, let's review the minutes from the October 22, 2020 board meeting, November 4, 2020 emergency meeting, and December 30, 2020 emergency board meeting. Board member, Ms. Dis, can I get a motion to approve the minutes?
Yes, Madam President. I move to approve the minutes of the October 22nd, 2020 board meeting, November 4th, 2020 emergency meeting, and December 30th, 2020 emergency meeting.
Thank you. And is there a second to the motion to approve the minutes?
I second the motion.
Okay, Ms. Hawkins. So having a motion and a second to approve the minutes, if no objection from board members, the minutes are approved. This vote is being taken as that other motion was, according to Board Policy 2.7, Simplified Parliamentary Policy Rule 4. So let's move on to the consent agenda. Board members, are there any items on the consent agenda only that anyone would like to have pulled off the consent agenda? And this is for consent agenda only.
Madam President, before we go into the consent agenda, I would like for the record to reflect that Maisie Jamison has now joined the meeting.
Oh, great. Welcome. And Maisie, can you unmute? Hello, and can you introduce yourself for us?
Yes, my name is Maisie Jamison. I represent consumers on the board.
And you're from Dallas?
Correct.
Great. Well, we're glad the IT stuff was settled. It happens to all of us. Thank you. Welcome.
Thank you, Daryl.
Yes, and Daryl is our Daryl is our IT guy. Dan's with us
you
here.
too. Take care.
So Daryl is our backup. Great. Thank you. We couldn't do this meeting without our staff. Continuing with the consent agenda, is there anyone that has anything to be removed? I'm watching the screen for notifications. Okay. So continuing with the consent agenda, Can I get a motion to approve the consent agenda as written? And Rick Williams, could you do that for me?
Madam Chair, I move to approve the consent agenda as is.
Thank you. And do I have a second?
Second.
Okay, Laura Disk. Thank you. So we have a motion and a second, no discussion to approve the consent agenda. If no objection from board members, the consent agenda is approved. This vote is being taken according to the board policy 2.7, simplified parliamentary policy, rule number 4. So we're going to begin our meeting, but I want to say one thing on the consent agenda. Schools work really hard to have a full approval, and they go from initial approval to full approval at times. And I want to just state the schools that have obtained that. And I want the audience to understand that we have a lot of information here that we as board members have gone over, and they're on this consent agenda, so we don't discuss them in the meeting. But I think when schools have worked this hard, they should be acknowledged. And maybe some of those schools are in attendance and watching from YouTube. So the change in approval status from initial approval to full approval, which is a huge undertaking, are Galen College of Nursing in San Antonio, Texas, baccalaureate nursing degree education program. Rio Grande Valley College in Pharr, Texas, associate degree nursing education program. And one of our board members, Laura Disk, is from Pharr, so she is happy for her school there. Schreiner University in Kerrville, Texas, baccalaureate degree nursing education program, and Southwest University in El Paso, Texas, associate degree nursing education program. So that is really a great achievement for these schools. So moving on at this time, we will now begin the meeting by holding the open forum. So good morning, ladies and gentlemen. I want to get the time. It's 9:17. And on behalf of the board, I'm recognizing this time as the beginning of open forum. Normally, this is an opportunity for the public to voice observations and opinions about the regulation of nursing, the approval of nursing schools, or nursing practice issues which fall under the purview of this agency. We welcome ideas or recommendations about issues in nursing practice or education, and the information shared with us will assist the board in its regulatory role. The mission of the Texas Board of Nursing is to protect and promote the welfare of the people of Texas by ensuring that each person holding a license as a nurse in the state of Texas is competent to practice safely. Keep in mind the board's jurisdiction is limited to the approval of schools of nursing, examination and licensure of nurses entering practice, and regulation of practicing nurses. Many aspects of healthcare, such as the operations of hospitals and the licensure or practice of healthcare providers other than nurses, are beyond this board's purview. In eligibility and disciplinary matters, the law provides that the board act on the basis of admissible evidence, which is secured and presented within the requirements of due process and the Administrative Procedures Act, the APA. Therefore, during this forum, we cannot receive information about any pending cases. We would normally invite those wanting to address the board to identify themselves and present information to share with the board. Members of the public were provided prior notice, both on the Secretary of State's office and on the board's website, of the opportunity to request to present verbal or written testimony related to this hearing. Board staff has received no requests for verbal comments and no written public comments. So having said this, having no requests, to present oral or written testimony. I am now closing the open forum, and this time is 9:20. I usually have a gavel when we are in our meetings, so there's no gavel, so we're closed. All right. Board members and staff will now proceed with consideration of the remaining agenda items. The next item for consideration is agenda item 1.1, Executive Director's Report. Ms. Thomas will be presenting. Thank you.
Good morning, board members. You have a written report from the executive director, and I'm going to highlight a few things for your benefit and for the audience. I reported that there are 34 states that have entered the Nurse Licensure Compact. This is the newest version of the Nurse Licensure Compact. And I did comment that New Jersey has only partially implemented in March of 2020, but they plan to fully implement this year in 2021. So stay tuned for that. Right now, they're allowing compact nurses from other states to practice in New Jersey, but they're not issuing compact licenses at this time. We expect there to be a number of states that will introduce the compact legislation this year. I believe there'll be 12, and 3 that will introduce the APRN compact. We can always be surprised that some other states might enter as well, or might introduce the legislation. I want you to be aware that the National Council has launched a research study to investigate pre-licensure RN education during the pandemic. We're very glad to see this being done. It's going to measure the impact of COVID-19 on nursing education, and we know those have been many and very challenging for education programs. Right now, this study is underway, and there are currently 50 programs that, across the nation that are entered in the study, and they're either traditional baccalaureate or associate degree nursing programs that had to change their didactic or their clinical formats due to the pandemic. They're going to look both prospectively and longitudinally at the students to measure their engagement, their academic performance, and their early career experience. And we expect the study to end in 2022. We'll look forward to the results of that study. There are 2 statements that I've attached to my report. One of them is from the Tri-Council for Nursing on the status of the U.S. healthcare workforce during the pandemic, acknowledging the challenge to the workforce during this very difficult time. The second one is recommendations about the COVID vaccine administration. They are generalized to any state, so they're not specific to our state. You're aware, at least those of you in education, that NCSBN has a Practice Academic Partnership webpage resource encouraging both academic institutions and healthcare facilities to work together to make it possible for students to participate in clinical experiences during the pandemic. Many of you may know that during the pandemic, clinical sites closed their facilities to students, trying to focus their efforts on their own staff and taking care of the patients. But as it's become, in some cases, overwhelming, we've seen more agreements to let the students come back and more comfort with that as well. So we have followed our own programs and will continue to do that to see how the COVID pandemic has affected the educational programs and their academic partners. During this week, the Texas Capitol has been closed. During the inauguration in particular, we anticipate it will open again, but the House and the Senate are not meeting this week. Each of the chambers is going to establish their respective rules and protocols to start the session, and so we're watching for that carefully. They have already implemented some measures to protect the staff, the members, and the public against COVID-19. Those are cleanliness policies, mask wearing policies, and so on. Many of the hearings we believe will take place virtually, but we will wait and get that advice as we move along in the process. I just want you to be aware for the Health Professions Council that in February next month, their website will be updated to include their annual report for 2020, and that is a report that looks at all of the agencies and the various performance measures for each agency, as well as the programs that the Health Professions Council engages in to facilitate the work of the members. Just a couple of words about NCLEX during the pandemic. Initially, Pearson VUE had closed some of its testing centers. Those opened fairly quickly in the first few weeks, and they are now at full capacity and have been for several weeks. So the candidates who receive an authorization to test from the Board of Nursing are able to schedule within a few days. We are, however, watching the pandemic surges to see if it's going to result in any changes to the capacity limits on these testing sites, but so far that has not affected us in Texas. I want to remind you that the agency is participating in a predictive analytics project. That's a research study that is investigating the potential of decision support tools, those are computer tools, to support our decision making in evaluating complaints against nurses. And that's happening here in Texas, as well as in the United Kingdom and Australia. The project is investigating the use and support of one of these tools for improving the consistency of our decision making in evaluating complaints. We hope that the tool will assist us in streamlining the early assessment of complaints and allow us to focus our efforts on more high-risk matters so that lower-risk items can be closed out more quickly. The study should complete sometime this spring. The COVID-19 pandemic, you've been briefed on this in past board meetings. We have undertaken a number of initiatives to respond to the pandemic, and we continue to do that. Much of what we are doing now is answering questions from constituents, from nurses and employers and others about the effect the pandemic is having on them directly. We have tried to maintain our mission essential functions in all areas and have been successful in doing that, not without its challenges, as I will get into a little bit more when we talk about the annual report for 2020. We have remained closed here in the office. That means that most staff are working from home, that is working remotely. We do have staff coming into the office. I estimate between 17 and 25% of the staff are here on any given day. That is staff that rotate in and out, and they're here for necessary work that can't be accomplished at home, such as scanning and sending documents to staff that are working at home. We have purchased all the equipment we need for people to be able to work from home, and we are still having no travel. We maintain that policy that we will continue this work arrangement until we know any other information that would change that. That means that if the pandemic eases up significantly, if the vaccine is widely available, or if we have direction from state leadership to do otherwise, that will change our course. We are ready to do that whenever it happens. We have a return to office plan. It's really well developed, and it's consistent with the national guidelines of the CDC and DSHS. We have done a number of things to keep the work going. One of those things is to change our workshops to virtual format, and they're continuing just as if they were going to be in person on the schedule that has already been outlined for the year. Staff meetings and department meetings and board meetings have all gone virtual, and we're all adjusting to that pretty well. Our informal settlement conferences, our mediations, and our contested case proceedings at SOA are also virtual. And we've learned a lot through that process, and it's going fairly well. And our call center continues with our staff at home. So they are able to answer calls from their computers at home and help people who are on the line. I want to say just a few words of appreciation to the staff. This has been a very difficult year in many ways, and they have risen to the occasion. They've done a phenomenal job, and I'm very proud of their work. That is all I was going to highlight in my report, but I'm happy to answer any questions from the board.
Sorry, technology. I just want to echo what you have said. You know, these are uncharted waters that we've been in, and it just happened so abruptly. I'm in academia. You know, we had spring break and didn't come back. And so I know the staff was doing that as well. And when you have over 100 employees and you're trying to do that workaround and just the whole anxiety of the situation. So I do appreciate your leadership, Ms. Thomas, and in doing that and continuing on with the work that was there. And I know the other board members have echoed that same thing and about staff and about your directors doing that. And then implementing a lot of things during this time as far as orbs coming in and Mr. Mike and what he's had to do with that and just continuing everything. And then also about moving our facility and those kinds of things that have required attention and just keeping the staff safe. I think that is really, really important. You've had very low occurrence of COVID. And so thank you for that. And thank you, staff. I don't know if you can hear clapping, but we, as a board, do really want to acknowledge that. So anything else, board members, to contribute? Or okay. So now we will move on to agenda item 1.3. And 1.3 is the executive, the Texas Board of Nursing Fiscal Year 2020 Annual Report. So Ms. Thomas will do that as well.
So board members, the staff prepare an annual report at the end of the fiscal year and present it to the board every January. So this is the 2020 annual report. Because this has been a very unusual year, I want to highlight a few things that are included in the report. In the beginning of the report, you'll see that in all of the areas of the agency's mission essential functions, there are infographics that illustrate some of the 5-year changes that we've seen and what's happened to them in 2020. The average growth in our RN licensure was just under 4% and APRNs were just under 9%. So those are significant trends. And you can see that growth has been occurring over the last 5 years. So it's not an unexpected thing. Our LVNs, however, have flattened their growth now, and we see that they are, I think, increased by like 0.6% this year. So the numbers are fairly low. When we look at the reason for the growth, we see that the number of RNs licensed by exam has continued to increase, but those by endorsement from other states has declined 3% over the last fiscal year. So there are less nurses coming into the state and more nurses being educated in our state. If you look at the infographic on our revenue and expenditures, this is a common trend for us. We have experienced steady growth in licensure because there is a steady growth in our population and the growth in our facilities over the last decade. But because we have more nurses being licensed, we have additional revenue that we collect. And we seek to keep our fees as close to what our appropriated monies are, but we are raising additional money, and that money goes back to the general revenue. In the enforcement area, current discipline continues to affect a very small part of the population of nurses. So it's 0.4% of registered nurses, 0.7% of licensed vocational nurses. So those numbers stay very low. In terms of the cases that we close in 6 months, the board closes about 8 out of 10 of their cases within 6 months, and others are a little bit longer. You'll see that we fell a little bit in the number or in the percentage of cases closed in 6 months from 89.7% to 88.5%, from 19 to 20, but it's a fairly small decline. In our education area, from 2016 to 2020, we approved 27 new nursing education programs. That's pretty phenomenal. 11 of them were baccalaureate and 8 were associate degree and 5 vocational, 3 were APRNs. If you look at our pass rates for the NCLEX RN, you'll see that it steadily increases. And we've reported here through 2019 because at the time we didn't have our 2020 data. So in this particular board agenda, you'll see under 3.2.7 that you have a report on the RN NCLEX pass rate, and it's 91% this year, with the national average being 86.76%. So again, we exceed the national average and have over the last 5 years. We're very proud of the work our programs have done, but we are closely watching NCLEX, as I mentioned earlier, to see if the COVID-19 pandemic affects that pass rate in any way, and that will continue to be followed through the pandemic and after. So we will report on that regularly to you. Just a couple of highlights from our narrative. We opened 13,000 complaints, a little over that, and that was less than 2019, and about the same number that we opened in 2018. We think that the change over time has been a result of some changes that were made during the 2017 sunset review of the agency that had to do with criminal matters. And we also saw a little decline in the second half of this year that may have resulted from the COVID pandemic. We speculated that that could be fewer patients seeking routine care because there were limits on those types of visits. And also because family members were not allowed to be in those healthcare settings, and some of our complaints do come from family members. I'm going to pause here to recognize Board Member David Saucedo has joined the meeting at 9:38. Welcome, David. We also have had vacancies in our enforcement area, just as we have in licensing. That has occurred because during the pandemic, the agency was required to reduce its budget by 5%, and that's this last year and this year. And that meant that we couldn't hire people. And so we had a number of vacancies, and our average investigator caseload increased by 19% in 2020. We had a slight increase in the number of complaints that resulted in discipline, but it's pretty insignificant. Our informal settlement conferences, as I mentioned earlier, continue to go on, but they're happening virtually, as are our mediations and SOA hearings. And that's going pretty well, although it slowed down significantly. In the beginning, SOA canceled a lot of hearings that had to have new dates set for continuance, and that delayed a number of cases, but we are working those cases and have been ever since they began to set new dates, and making progress in that area. I mentioned earlier that we've had a pretty notable growth in the number of APRNs issued licenses. It grew by 8.5% from 19 to 20. And that we're watching carefully. There is going to be more demand in the future for APRNs. So we want to keep an eye on that. RNs coming by endorsement has decreased, and that could be a result of the nurse licensure compact passing in some of our formerly big endorsee states, such as Florida, Oklahoma, and Louisiana. We usually receive a high number of applications from those states, and those nurses can now be eligible or may now be eligible for a multi-state license. In the area of licensing, a couple of other things I wanted to point out. We implemented the new nurse portal during this year. That transitioned us from a paper-based model to a completely paperless system. And we also had to educate the public about how to use the portal and coordinate its implementation here at the agency level while we worked from home. So that has resulted in a lot of workload for the agency. During this time, we experienced a tripling of emails to our staff with questions and a doubling of our phone calls. So it's been a big workload issue for the agency. Of course, the governor issued the proclamation of disaster in March of this year and has continued it every month since then, as is required by law. We are, as I mentioned earlier, working from home. So if you couple the adaptation of the Texas Nurse Portal with the transition to home and the effects of COVID, those are the two big factors that have affected our performance slightly, but also our workload for agency staff. You know, in the beginning, when we had the testing center shut down, not only in Texas, but throughout the country and throughout the world, it had a big effect on delaying processes for applicants. Fingerprinting appointments were also delayed because there were the fingerprint centers decreased the number of people who could come in and be tested or be printed at any time. So the testing and the fingerprint delays really got us behind, and we worked hard to catch up with those numbers. Okay, and lastly, I just wanted to highlight that although we have seen an effect on our performance measures, we're making a great deal of improvement in our processing times. We have been able to fill some of our positions, but we are doing that very cautiously as we don't know what direction we'll get from the legislature and whether we'll be required to continue that 5% in the coming year. I'm happy to answer any questions you might have about the annual report at this time.
Any questions, board members? It's been a busy year, and I really like these graphs. So the one thing I just wanted to say is we've got 345,000 RNs and we have 107,000 LVNs. So that puts us over 450,000 nurses. And in the RNs, then we have the APRNs that are 36,000. So that continues to increase. And then we're decreased in staff. And then we've had the COVID. So appreciate the work that you're doing. And I know that it's been some busy times. And I know you guys were working around the clock when the pandemic hit and you were dealing with that. And then we were implementing ORBS at the same time. It was supposed to come in April. It came in June. And still, you were able to get that done. So that was a very good work. And for the whole group and Mark's group. So this is not a voting, it's a information. Any questions, board members?
Madam President, this is Patricia. For the benefit of those people that are observing through the YouTube channel, I wanted to point out that on our website, all of our board meeting reports are under the January 21, 2021 meeting tab. and they're listed so that if anyone observing wanted to see what the board members are looking at, they would have access to review the reports there. They are posted on our website.
Thank you for that. I wondered that myself while this was occurring, so appreciate it. Okay, at this time, we will go to agenda item 5.2.1.
Madam President, we're going to be having several presenters join us. They've just been added to the meeting room, so I wanted to point that out to you.
Okay, and this is the task force to study implications of growth of Texas nursing education programs. And I think our Director of Nursing, Dr. Benton.
Yes, good morning. This is a non-action item. This report is intended to provide you with an update on the work of the task force. As Patricia shared, we have 4 guest presenters with us here today, and I'll just introduce them briefly. We have Dr. Patricia Yoderwise, who is the chair of our task force, and Dr. Paula Webb, who is a representative of the Texas Organization for Nursing Leadership on the task force, and Dr. Brandy Wells. I don't think her camera is showing, but you can see her name. Dr. Wells worked under the guidance of Dr. Porter Edwards in her work in helping prepare the report that we're sharing with you today, as well as Dr. Leslie Norman, who was also a doctoral student at UT Health Science Center Houston and worked with Dr. Edwards also. So just to give you a little bit of background, the task force was established as the growth of nursing educations really started to take off. You heard in the annual report that Ms. Thomas gave, we've approved 27 since 2006. And so as that growth started to skyrocket, a group of education stakeholders were brought together through the board. And I want to mention that Dr. Yoderwise has been the chair since its inception and in 2012 when they first met. Through their work, there have been a number of products that have been developed. There have been education guidelines to better define how precepted clinical learning experiences can be successful, as well as utilization of part-time clinical faculty. And then in 2014, there was a monograph developed to really look at excellence in clinical education that was disseminated in writing through publications as well as a statewide workshop. Now, more recently, the task force has been working to address its charge to address the gap between nursing education and practice and to really optimize clinical learning experiences. And so long ago in the pre-COVID world, we had a statewide summit that was an amazing experience. And I also want to recognize Laura Disk and Dr. Edwards as our task force liaisons who attended the summit, and Mr. Saucedo, who presented at the summit. And so following the summit, the report writing began, and also COVID entered our world. And so it took a while to really synthesize all of the findings, primarily because this was a World Cafe format, and there were over 100 participants who circulated through conversation tables, and notes were taken by volunteer DNP students. And then all of those notes had to be synthesized and analyzed, which We owe a great thanks to Dr. Norman and Dr. Wells. And then after that, through the support of the Texas Organization for Nursing Leadership, we're able to contract with Dr. Beth Ulrich at UT Health Science Center, Houston, who started the report writing. And so you have an attachment A to this report, the final summit report with the recommendations for your review. We will plan to disseminate this in several ways, but it's not yet, other than attached to this report, it's not yet been put in our newsletter or been put on the website. This is not a voting item, but we wanted to certainly share this exciting report to you. And I want to highlight that this was a real first in the state. This was the first event that the Board of Nursing co-produced with a nursing organization. And it was a huge success. And I want to invite Dr. Paula Webb, who represents the Texas Organization for Nursing Leadership, who was our partner in presenting this summit, to offer her comments. Thank you.
Yes, and thank you so much. I'm Dr. Paula Webb, and during the time that we were formulating this plan with the Texas Board of Nursing, I was the president of the Texas Organization for Nursing Leadership. Thank you for your time this morning and for your support of this event. Texas Organization for Nursing is honored to be the first person that the first group that the board felt and that they had confidence in to co-sponsor an event of this magnitude, and we do recognize that that was a big honor for us, for our organization. Prior to joining the board task force, Tonal had surveyed the chief nursing officers and the deans and directors of our academic facilities throughout the state to ask them to identify their top 3 issues and challenges that they felt they were up against during the time even pre-COVID, and it's been even exacerbated with the COVID pandemic. We received many responses. However, our top 3 included, for both the chief nursing officers as well as the deans and director group, the transition of newly licensed registered nurses into practice. It was at that point that we convened a group of chief nursing officers and deans and directors so that we could begin the discussion about how we could work together to make this transition feel more seamless, not only to the organizations and the universities, but also to the students that and new nurses coming into our organization. It was around that same time that I was invited to be on the task force as the president of Tonal, and joined the group. And we felt it was such a wonderful opportunity for us because we could come together as one voice for our state, one voice for our nurses, one voice for both academia and practice to move forward. And it was very empowering to our organization as well as to our colleagues. Being able to do that allowed us to be very selective in the group of folks that we invited to our summit. And we reached out to professional organizations, we reached out to our academic partners on all levels for them to send the folks to this summit as representatives to bring their voice to the group. And I think that that approach, allowing everyone to send the people they felt could be their best representative, enhanced our abilities to get to where we are today. After today, Tonal is very committed to continue to work with the board on the dissemination of this work, as well as taking the lead on many of the recommendations that are going forward post-summit and for future endeavors. So again, on behalf of the board of Tonal, I would like to say thank you for your confidence that you showed in us and your continued support of the work that we have identified, and a lot of work that we have to do based on the recommendations from our summit. So at this time, I'd like to introduce Drs. Leslie Norman and Brandy Wells to discuss our data analysis.
Yes, thank you, Board, for allowing us the time on your agenda. I'm just going to give you a brief introduction of our experience, and I'm going to let Brandy take it and take a deeper dive into actually what we did with the data. So Brandy and I were DNP students at the time at UT Houston, and we were actually afforded the privilege of working with Dr. Benton, and Dr. Edwards was our mentor on the summit as a fellowship project in our last semester of our program. And we were able to participate in things like the summit planning committee meetings. We also served as table facilitators during the World Cafe Summit. And after that, it was where the bulk of the work came in harvesting the information. As Dr. Benton said, it was a lot and it took a while, but we actually did a great job working together to make sure we were synthesizing everything adequately and robustly. And we also helped Dr. Ulrich as she was piecing together this report. We had many meetings with her to try to make sure we captured all the information that we needed to. Our experience was very enriching. We were able to observe so many things that actually helped us learn and grow. Ultimately, we graduated in May, so that was a good thing. We're very fortunate to have been able to live this experience beyond our graduation, which was report writing. And as a matter of fact, I have also been talking to similar leaders in our state organizations such as NOLN. I'm in Louisiana currently, and our nursing association, our board, and they were very, very interested in replicating this process. One of the calls to action in the summit was we would like other states to do this. So I'm trying to take this experience and actually carry it forward in the state that I'm practicing currently. So we just wanted to thank everyone for the privilege of being able to serve and help with this process. So I'm going to pass it over to Dr. Wells, who's going to discuss our project in a little more detail.
Hello, everyone, and thank you. I would first like to say that I am sorry that my visual is not working, and I know that all of you could understand what may be going on. We are having to move out of our offices to an entirely different pavilion, and my office is the only one not moved so I could have this meeting. So they have disconnected everything except for my computer audio in my computer, and they're just waiting for me to finish. So thank you very much for allowing me to join, and I'm sorry about my video. So just to go a little deeper, the role that Leslie and I held on the planning committee was what really prepared us for our role as facilitators. We worked and were on multiple meetings leading up to the day of the summit. And so we were prepared for what data we needed to gather on that day. We were able to engage with the academic and practice partners and were able to feel the pulse in the room, which helped us to really feel what the vital concerns were that needed to be addressed, that were expressed by both disciplines, being the academic and the practice side. Leslie and I then took our data and we harvested the vast amount of data, which Leslie kind of spoke to. It was a lot of information. We wrote notes as each facilitator provided a conclusion of their perceived themes at the conclusion of the summit. Then we took those notes along with the notes that each facilitator had written during each session they had. And I believe there were 4 or 5 sessions where people were rotating. So there was a vast amount of data that we took, and we went line by line, split it up between Leslie and I, and there were glaring themes that were evident. Those themes that we noted were clinical placement and scheduling, work environment, quality, and of course, APR and practice. Once we had our primary themes, we were able to dive into what we felt were the sub-themes, which are visible for your review on page 22. And then further within the report, pages 23 through 28, you can see issues that were brought forward during the cafe. And some of those ideas that were noted in the blue ovals were actually thoughts that were brought forward from attendees at the summit. And then we have ideas for improvement, which we noted in the peach ovals on the slides. And then there have been recommendations for improvements with lead action groups and priority dates, which are noted on each page following the themes. And I just want to say that I grew as well, as Leslie stated. I learned so much from attending a few of the board meetings under Dr. Edwards. It's nice to see all of you, although you cannot see me, but that was a very fun time throughout my education and my career. And I have taken things that I learned with the Board of Nursing and have utilized that in my practice. I am the Assistant Director of Nurse Practitioners at Texas Children's, and I truly felt that that time I spent with you was very pleasurable, and I look forward to assisting further with some of the issues that we have identified. Thank you very much. And I believe I now turn it over to Dr. Yoderweiss.
Yes, thank you very much. Well, first I'd like to begin by saying something that I know all of you know, and that is that we have a spectacular group of staff employees in the nursing education area of the Board of Nursing. And they were most facilitative of developing the meeting, of helping to secure speakers, of doing follow-up, of picking up pieces of paper so we didn't lose any of the ideas. So I want to acknowledge Dr. Benton and her staff, and I hope you will share with your staff how much we appreciate, because they really made it a success. Well, if you would look on page 22 of your report, you will see the 4 big theme areas of clinical placement scheduling, work environment, quality, and APRN. And from those 4 themes, with all of the richness underneath those themes, we organized action ideas and made recommendations. And in the same spirit of conducting the World Cafe, where everybody shares, we offered various groups throughout the state the opportunity to lead action. And being designated as a lead organization under the recommendations, and those start on page 23, did not mean that they had to do the work. What it meant was that they were accountable for the work, whether they chose to do it themselves or delegating it to someone else or causing something to be initiated as action. So after the work by our 2 doctoral students, no longer students, and Dr. Beth Ulrich, we created the recommendations. So for example, as a recommendation under clinical placement, which is on page 24, if you look at number 5, it says, explore regional clinical placement committees to assist with allocating clinical space. That was one of the precipitating concerns for the work of this 3rd part of the task force that we have had ongoing now for 9 years. And what we did with that was to say tonal was the appropriate group to bring together clinical leaders and educators to talk about how best to use clinical placement opportunities. That was clearly a theme throughout. We also made some global recommendations. I would say that there's examples like that under each of the specific recommendation areas. But we also made some global recommendations, and these derive from repeated ideas and the summit evaluation. Again, we chose logical groups to take on those recommendations. So if you would look at excuse me, page 30, for example, number 4 says, hold a statewide conference related to social determinants of health and how to incorporate them into the curricula. And so we asked Texas Teen, TNA, and TABNY to come together to make that happen. Another example is exploring the ways to resolve the issues of students using the electronic health record. That was a consistent concern expressed before our meeting, during our meeting, and on evaluation comments. And we asked, again, Tonal, if they would take that on. So we are delighted with the numbers of groups who have agreed to work with taking these recommendations and bringing them forward. I would point out that one of the recommendations was to hold this same kind of a meeting every 2 years in the non-legislative years so that we could come together to continue to dialogue and to identify issues and take action on them. Out of this work, you have 10 theme-based recommendations and 8 overall recommendations. Additionally, there are 2 recommendations that you will find on page 31, and those are directed to individual schools and healthcare organizations for their consideration. So that comprises the outcome, if you will, of our 2-day summit that we held, well, 1.5-day summit that we held in Austin. So I will turn this back to Dr. Benton.
Thank you. I just want to open it up for any questions or any comments that board members might have.
Good morning. This is Kathy Lederhorn. I wanted to say, I know it's difficult to review this with Zoom and everything, but it's an incredible report and incredible work. I will say way back.
I think we lost you, Kathy.
I'm back now. Way back in 1991, my first day on the floor, my nurse that I was following said, "Nurses eat their young, get used to it." And I was like, you know, like, oh my gosh, what did I do? But I love all the care that you guys went into it, and the World Cafe, some of the things that you've come up with, you know, I never even thought of. So I look forward to seeing this come to fruition.
I'd also just like to ditto what Kathy said, but also just thank again the students, the staff, Dr. Yoder-Wise. This was a tremendous effort that spanned months of preparation, that Kristen was really spearheading, and Dr. Yoder-Wise with the support of the staff. And of course, then the emphasis was placed on the students producing a deliverable and those themes, and that was a tremendous amount of work to 2 nurses that were not only in a DNP program, but that were also full-time employed. So just a tremendous effort by all. Thank you to the students and all involved.
Thank you.
I just want to say thank you to our guests for the work that they did on this project, for their willingness to be here today to share that with the board. This has been, as others have said, a phenomenal amount of work. And of course, to our staff, Dr. Benton, Dr. Hooper, Dr. Zeich, all of these folks were very involved. And Sierra Williamson, who is our administrative support staff, who did so much to bring the group together and to facilitate the meetings. So we're very appreciative, and we look forward to the future work of this and other groups to make these things a reality. So thank you very, very much.
I just wanted to add one other thing about how important this is. So I am the chair for the presidents for the National Council State Boards of Nursing, and we have a discussion about this at every annual meeting with presidents of the country for the boards about this issue of academia and practice and bringing them together. So this is just foundational that can even go and be shared and just move on. So it's just really exciting. And Dr. Yoderwise, I know you've been at this for a long time, but I'm just excited about how we'll have it and be able to share. And like they've talked about sharing in Louisiana, but this is national, can make a difference. So thank you for this work.
Thank you. And I would suggest that you feel free to distribute this report among your colleagues in the other states, because the process was beautiful. It produced well, actually more than what we expected. And people absolutely raved about the opportunity, not only to meet people they've never met, who would be people they should have met, but also the opportunity to express their real concerns about clinical placements, about practice issues that impact education programs, about education programs in terms of being relevant for producing graduates that are needed today. So I hope you help us disseminate it.
Thank you. Thank you. Ms. Disks, you were there. Did you have anything you wanted to add?
I just want to thank them for all their hard work, but mostly it's just so awesome to see the board working with an organization and growing our future, our nurses. That is the most rewarding thing of all, to see that come from the board. So thank you all for your hard work. It was awesome.
Thank you. Thank you. So this is not a voting item, I don't think. Let's see.
That's correct.
No, it's just information. So Dr. Benton, do you have anything else to say?
No, other than just echoing all the thanks. It was truly a group effort that took a huge amount of coordination. And I want to reinforce thanks to our staff who staffed the summit, who planned those incredibly complex rotations of conversation tables to make sure there were no replications. It was quite a matrix. We really had a great deal of fun doing this, and just want to say thank you.
Thank you.
If you all look through the report, you'll see the talking stick, and that was the idea of Dr. Hooper, who actually made the talking sticks, and it allowed everybody to pass that around and have an opportunity to say their piece, to share their own perspective. So, I mean, it was a fun, creative endeavor, and we're very appreciative to everybody. And Dr. Yoderwise, I will tell you, we will help you distribute this. And I have it on my to-do list right now to send this to Dr. David Benton at the National Council of State Boards of Nursing. He's the CEO. And I'm making a list of all other people. Welcome any ideas you all have. So we will
Great.
share it.
Thank you very much.
Thank you. And Kristen, for just one more second, the first day we had a lot of speakers who came in and laid some foundational work for us before we went into our World Cafe. And one of your key members on your board, David up there on the corner, did a phenomenal job of bringing the parent-patient perspective to the group, so that as we went forward with our work, we weren't just focusing on nursing, we were focusing on our patient and the impact that our work had on the patient. So thank you, David, for being there, and thank you again for the board's support.
Hello, everyone. Yeah, if I may, it was really nice. Of course, Kristen and the team for inviting me. That was really probably my first comments. You know, after after kind of what happened to me, and it was a very special event to be with you all. And it was special. I enjoyed it, and I'm glad that you all liked it. I did get a lot of feedback. I mean, I wasn't necessarily expecting that, but I'm glad I was able to contribute, and thank you for the invitation. And again, the energy was very, very high. Fantastic event. So kudos to you all.
I have one, I have a text message from Dr. Hooper to make a clarification. It was Dr. Gail Varnell who made all the talking sticks. She harvested all the wood from her her farm, and made the beautiful talking sticks, which have a showcase in the report. You'll see photographs.
Thank you. And thank you so much. I think at this time, I was wondering if we could take probably just a short break. And I'm not sure how we do that, Patricia.
Just take a break.
Okay. So getting you new to all of this.
We'll just
So
we'll take a time limit on it if you'll set a time on it.
Okay. Okay, so I have that it's 10:15, so let's come back at 10:25. That's about 10 minutes. Okay.
Okay, thank you.
Dan, did you get that message? Did you hear we're on break right now?
He's on mute.
He might have stepped away. He has to pause the feed for the YouTube. Oh, thank you, Dan. Sorry.
Okay, so we've got
Kathy, I'm just not sure if the board members are in the room or not, so can we wait till their videos come back up?
Okay. There's Laura. Rick is.
There we go.
Oh, Allison.
And I think, okay, I think we've got everybody here. Gina's
Here
here.
comes Allison.
Okay.
4, 5, 6, 7, 8, 9, 10, 11, 12. No, 11. Okay, we're good. Okay. Okay, welcome back. Next on the agenda is item 5.3.1.a. And before we get to that, we do have some staff that have joined us at this time. So if you would introduce yourselves. John? Okay, we'll go on to Gina. I guess he's having trouble.
Good morning. My name is Gina Abel. I'm an attorney for the board.
Thank you. And Elise?
Good morning. I'm Elise McDermott, lead nursing consultant for practice.
Thank you. And John?
This is John Vanderford, attorney for the board.
Okay.
I'm hearing a lot of echoes. I think I need to leave and come back in.
Okay. And I think that's all. Okay, so appointment of board members to attend the National Council State Board of Nursing virtual mid-year meeting to be held March 9th to 11th, 2021. And what we've usually done is rotated different members. I attend as president. The first day of the meeting is the nurse licensure compact, and then Ms. Thomas and myself do a president executive director day of meetings, and then we have the other 2 days of meetings. And so it's going to be virtual this year again. And I couldn't find my information about the number of people going, but I think whoever is interested. And Ms. Thomas, did you have that? There's not going to be a cost, is that correct?
As far as I can determine, that is the case, and it's the number of attendees is open. So I think as many board members as want to participate could.
And this is not like the annual meeting where we have voting, have the delegate assembly.
Right.
So there's not really participation other than just gaining the information and being able to be part of that and understanding more about the organization and how all the boards work together and what National Council does. So are there any members that are interested in attending? You'll still need to register for that. Laura? Okay. I'm looking for hands raising. I'm not sure. Is there anyone else? I don't want to miss you. So last year, Kim Wright went, And I don't know if Kim, if you have anything you want to say about it, what that was. In fact, I think that was our last travel. So.
It was phenomenal.
I think it gives you more of just insight into regulation, opens up what all is involved, and I think helps to understand the bigger picture of what we're part of for national regulation. So is there anybody else that's interested in going? Attending, it's not going, attending. So you can think about it if you are interested. Okay, I'm just trying to see if anyone is acknowledging. Okay. So this is a no action required also. So just get in touch with us if you think that is something that you might want to do. Next agenda item is 6.2, consideration of adoption of amendments to 22 Texas Administrative Code 217.23 relating to balance billing dispute resolution, including written comments received, if any. Ms. Abel?
Thank you, Madam President. Good morning, board members. As you'll recall, at the October 2020 meeting, the board approved amendments to section 217.23. Those amendments were published in the Texas Register, and we did receive 2 comments. Those comments are included in attachment A in your packet. Attachment B is a summary of the comments and staff's recommended responses to the comment. Staff is recommending to the first commenter from Quest Diagnostics that we not make any changes because staff does not believe that the statute gave authority for the board to establish required payments for out-of-network providers. And the second comment that came from the Texas Medical Association, staff is recommending that the board make that change. That change related to an inadvertent inclusion of the word facility that should not have been in that subsection. It doesn't change the remainder of the subsection, but that word probably should be omitted. And if you look at attachment C and you scroll down until you find the highlighted portion, you will see how that change would affect the final adoption of those terms in that subsection. I'm happy to answer any questions you might have. Staff is just recommending that one minor change, and it would be a voting item to authorize staff to publish the summary of comments and proposed responses in the Texas Register, as well as making the change that you see in attachment C to the rule text as adopted.
Any questions, board members, or statements? Okay, Mr. Williams, could I have a motion on agenda item 6.2?
Yes, Madam President, I move to adopt 22 Texas Administrative Code 217.23 related to balance billing dispute resolution with changes as set forth in attachment C. Further, authorize staff to publish the summary of comments and response to comments attached hereto as attachment B.
Thank you. And do I have a second to the motion?
Melissa Scott, and I second.
Okay, Melissa Scott, thank you. Having a motion and a second, we'll now take an oral vote. Dr. Edwards?
In favor?
Laura Disk?
Okay.
Okay, make sure you say your name.
Laura Disk, yay.
Okay, Carol Hawkins?
Do you want me to correct it?
Madam President?
No, we're okay. I saw you. Okay.
Carol Hawkins.
Kathy Lederhorn,
Kathy Lederhorn, 4.
Maisie Jameson,
Maisie Jameson, 4.
David Saucedo,
David Salcedo, 4.
Melissa Scott,
Melissa Scott, 4.
Francis Stokes,
Francis Stokes, 4.
Rick Williams,
Rick Williams, 4.
Kim Wright,
Kim Wright, 4.
and myself, Kathy Shepfar. And Dr. Edwards, I think we do need to go ahead and do that since it's part of the record, even though I saw you.
This is Allison Edwards. Sorry, my background noise happens to be going off at this time. This is Allison Edwards voting for.
Okay, so the motion passes. Thank you very much, board members and Ms. Abel. Next on the agenda for consideration is agenda item 6.3, consideration of adoption of rule review of 22 Texas Administrative Code chapters 213, 216, and 221, including written comments received, if any. Mr. Vanderford?
Thank you, Madam President, board members. This rule review notice was posted December 11th, 2020, and it was regarding chapters 213, 216, and 221 for a 30-day comment period. During that comment period, staff received notification from the Regulatory Compliance Division of the Governor's Office that the board needs to submit Board Rule 221.14 for review prior to the readoption of that section. So, based on the directive from the Governor's Office, staff will conduct an extensive review of Board Rule 221.14 and bring any recommended amendments to the board for consideration at the April board meeting. The readoption of Rule Review 213, 216, and 221 will take place after any rulemaking for Board Rule 221.14. So to summarize where we are with the rule review, in April, we will have some analysis and recommendations for the board members about any potential changes to Board Rule 221.14. And in the meantime, the review will be left open. The rule review will be left open. And all of these chapters will remain in effect as they are now until we're able to resolve the 22.1 amendments with the Governor's Office and submit those to the Texas Register and go through the notice and comment rulemaking procedures. So the rule review, our recommendation is that we do not adopt the rule review until we have dealt with this rule within the rule review 221.14. And once we have dealt with that potential amendment, again, we're going to bring these ideas to the board and see what can be done about this rule in April. And the review is going to be left open, and everything will remain the same as far as our rules and laws until we are completed with this process. And then we will adopt the rule review of those chapters. So I know that was a lot of legalese maybe, and I'm happy to answer any questions about this item and where we're going with it. Thank you.
Okay, board members, any questions? So this is informational for us and no action is required until we get information. So anything else? Okay, thank you, Dawn. Also, Dr. Hooper has joined our group here. Dr. Hooper, can you introduce yourself?
Yes, I'm Jan Hooper, one of the education consultants, and it's very good to see all of you this morning. Thank you.
It's good to see you. When we have our face-to-face meetings, Dr. Hooper always bakes something wonderful. And so we're not getting, we get her expertise and her baking skills, which we're not having since we're virtual. So that's, we're glad to have you today. Thank you. Next on the agenda for consideration is agenda item 6.4. Consideration of adoption of amendment to 22 Texas Administrative Code 223.1 relating to fees, including written comments received, if any. Sable?
Thank you, Madam President. Board members, this agenda item and several of the other ones that we're going to take up following this relating to rules, you might notice that there's a difference in when the proposals are being published in the Texas Register, which affects the ability of those comment periods to end prior to the board meeting, and also affects the timetable for when those rules can be adopted. And just to sort of provide you some background, recall that we are in the, I would say, the middle stages now of implementing these reviews that we have by the Office of the Governor. And essentially there's two places that happens. And so we have them reviewed prior to publication, and then the Office of the Regulatory Division also reviews them after publication. And at any point during that time, the rule can be held up while those reviews are taking place. So even though the board approved all of these rule amendments at the same time at its October board meeting, the rules themselves have different journeys, if you will, along the way, depending on who's reviewing them and how long it takes. And so that's why some of them have already been adopted. Some of them received comments and needed your approval for those adoptions. And then for this one, the fee rule, the comment period didn't end until this past Monday. So at the time that this report was prepared, staff was not sure if comments were going to be received or not. There were no comments that were filed before the end of the day on Monday. So this rule actually will go to the register sometime probably this week, and then will be adopted within 20 days thereafter. And that will be the case with many of the other rules that you see, is that we're waiting for that final time period to run. The board already approved the adoption of this rule if there were no comments received at the October board meeting. So staff does not need another vote on this item, but I did want to sort of explain the differences that you might see in the rules if you had questions about that. And I'm certainly happy to answer any other questions you might have.
Any questions, board members? Okay, thank you. Now, this is a little different than previously. Okay, now we're going to agenda item 6.5, consideration of adoption of amendments to 22 Texas Administrative Code 215.2 relating to definitions, including written comments received, if any. Ms. Abel?
Thank you, Madam President. This rule was also approved by the board at the October meeting. The publication for the proposal was December 18th, so there's the 30-day period that has to run before comments can be received. So this is another example of one that wasn't over until this past Monday. And so we did not get any comments on this rule either. So this rule will be going over for adoption to the Texas Register sometime this week. And then upon receipt, it'll be effective 20 days after that. And I'm happy to answer any questions. This is also not a voting item.
Any questions, members? Okay, thank you. Next on the agenda is 6.6, consideration of adoption of amendments to 22 Texas Administrative Code 217.7 relating to change of name and or address, including written comments received, if any. Ms. Abel?
Thank you, Madam President. This is an informational item. This was an example of one of the rules that actually went through the review process fairly quickly. And so it was published on December 4th in the Register. So the comment period ended a week and a half earlier than our other rules. and we did not receive any comments, so this rule has already been sent over for adoption and will be effective on January 27th of this month. This is just informational.
Thank you. Any questions, board members? Okay, next on the agenda for consideration is agenda item 6.7, consideration of adoption of amendments to 22 Texas Administrative Code 213.1 relating to definitions, including written comments received, if any. Mr. Vanderford? John, we can't hear you.
Is that better?
Yes.
Am I still here?
Okay.
So I'll be echoing Ms. Abel's comments regarding our comment period running up until the next board meeting based on the changes to the new processes. Regarding this one, as board members will recall, this amendment was related to the editorial changes updating the name of the agency within the rule from the Board of Nurse Examiners to the Board of Nursing. The rule proposal was posted following the October board meeting. The comment period has now ended and no comments were received, and the adoption of these amendments has been authorized by the board already, so this is informational only. Staff intends to send over its notice of adoption after this board meeting, and this is informational only.
Thank you. Any questions, board members? You know, I'm an older nurse and it was Board of Nurse Examiners for a really long time and hard to get away from that name. And some of you are smiling because you remember as well. But so it's good to get the name changed. Okay, we are now to the agenda item 6.8. Consideration of adoption of amendments to 22 Texas Administrative Code 213.20 relating to informal proceedings and alternate dispute resolution, ADR, including written comments received, if any. Mr. Vanderford?
Thank you, Madam President. Board members, this report is also informational only. As with the previous rule, the amendments were related to updating the name of the agency. The comment period is ended on this rule proposal as well, and no comments were received. So the adoption of the amendments has been authorized by the board already, and as such, staff will be posting notice of adoption later this week.
Okay, any questions, board members? All right, thank you, Mr. Vanderford. Next on the agenda is 6.9, consideration of adoption of amendments to 22 Texas Administrative Code 211.6B relating to committees of the board, including written comments received, if any. Ms. Abel?
Thank you, Madam President. This rule was also approved by the board at its October meeting, and the time for comments ended this past Monday. We did not receive any comments on this rule, so the adoption's already been approved by the board at its October meeting, and staff will be sending the adoption over sometime this week. And this is just informational.
Thank you. Any comments, board members? Okay, next on the agenda is 6.10, consideration of adoption of amendments to 22 Texas Administrative Code 222.4 relating to minimum standards for prescribing or ordering drugs and devices, including written comments received. Ms. Abel?
Thank you, Madam President. This is the last rule that was approved by the board for amendments at its October meeting. The public comment period also ended Monday. We did not receive any comments on this rule, so staff will be forwarding the adoption over to the Texas Register later this week, and it will take effect 20 days from the date that they receive that. And this is also informational.
Thank you. Any questions, board members? Okay, we will move on now to agenda item 7.2, consideration of proposed updates to the differential essential competencies of graduates of Texas nursing programs. This will be Dr. Hooper and Dr. Benton.
Thank you, President Shipp. So this is an action item for board members to consider recommended revisions to the differentiated essential competencies of graduates of nursing programs in Texas, otherwise known as the DEX. At the January 2020 board meeting, the board issued staff a charge to review and update the DEX that had previously been reviewed and published in 2010. So it had been 10 years. And then at the October 2020 board meeting, a work group comprised of education and practice stakeholders were appointed, and they met on November 9th after lots and lots of staff preparation, really spearheaded by Dr. Hooper and with the assistance of the education consultants, as well as Elise's team of practice consultants. So several internal staff meetings were held to really pour through the DEX, look at current literature, look at current practice, to really see what's necessary. And I think the pleasant surprise was that they really have stood the test of time. There definitely are some updates that you'll see in attachment C of your report. They're highlighted in yellow. But in general, it was not necessary in our view or in the work group's view to do a complete overhaul. Let's see. In addition to meeting with the work group to gather their input on the recommendations, staff sent out a survey that the work group also shared with their constituents, and we sent it out to all education programs. And attachment B provides a summary of any comments that we received. There were only a few, and our responses to those. I think, you know, these updates will really help to provide a current, uniform, basic, essential competencies for all new graduates that will not only set a standard, but will provide guidelines for the practice setting regarding utilization of new graduate nurses. I think, you know, we've always known this, but it really came to our attention during the Texas Summit, as well as this revision, that practice is not as familiar with the DEX as education is. Of course, the education rules require that education programs incorporate the DEX into their curricula. So we look forward to moving ahead with these updates with your approval and disseminating them widely to both education and practice. And at this time, I'd like to turn it over to Dr. Hooper, who can highlight some of the significant updates that we're recommending.
Good morning, board members, President. Kathy, this is a work of passion for me. We've been gathering information to do this for a couple of years. And finally, we did it even with COVID about us. And the beauty is, you heard one excellent report this morning about the summit. One of the areas for discussion at the summit was the DEX, so that it pulled this into this good partnership that we want to have between practice and education. So how do you start something this enormous? That date of 2010 has been a pesky thing for a while, and when Chris said, let's go, we started moving. And the first thing was to gather up as much literature, current standards, current documents, research, anything that we had used before, we got updates on, and new things, to note changes that need to be included in the DEX. I think we did a pretty comprehensive analysis of the DEX again to kind of peel it apart and see the pieces and what they mean. That was very helpful. It is a beautiful document, And as Chris said, it has withstood the time. And I think that's because the previous revision took 2 years with a lot of people coming to Austin for 2 or 3 days at a time to make this revision. So it's very good. There were principles set out that we would follow, and we were able to use those same principles. For instance, it is not a list of tasks. It is a list of competencies, and Texas is the only state that has something like this, so we're very proud of that. And some of the new concepts we picked up along the way to integrate the DEX is, and you'll see, oh yes, that, service excellence, self-care for nurses, spirituality and identity among patient characteristics, social determinants of health, workplace violence and safe environment, civility, cybersecurity, and then the new big one that has been added is about global health. And we also really wanted to enforce that the DECs are not just for nursing education, they are for practice. And we appreciate a number of the practice consultants meeting with us for 4 different meetings where everyone was very busily engaged in considering revisions and discussing it in depth. So here we are bringing it to the board. We're happy to bring this to you. And when it is approved and we're ready to move forward, there are other supplemental documents that will be added to the DECs. First of all, there'll be an introduction, including an executive summary. And we have something new. It's a board staff developed conceptual model, a picture of the DECs. There's a description of each of the scopes of practice, a glossary with terms with meanings specific to the DECs, a long list of references that were used, and a document talking about the implementation, and last of all, a list of committee members. So that's where we are. Thank you, Chris, for your leadership.
Thanks, Dan.
Excuse me for interrupting, Dr. Benton. Allison Porter Edwards let me know that she's going to sign out and sign back in. She lost her audio and video. I'm so sorry.
I know she's not here today, but I also wanted to thank Tamara Rhodes, who served as the liaison to the board. She was very helpful during the work group work.
Thank you. Thank you for that. This is very exciting. So after we approve this today, then you'll have a document that we can share, and you'll get those to us. So
that's right. And you may have noticed in the summit report of those recommendations, this was one of them, so we could check that off our list.
Wow, that's great. You know, being in academia, myself, I'm in practice and academia, a lot of even terminology has changed and emphasis on things. And I love the self-help. We as nurses need to be the example, and yet we tend, because we do service, we tend to care for others, and then we're at the bottom. And so I really like that. I don't want our young nurses to burn out. So I'm just scanning through the document again. It's just great. It just looks great. So at this time, I need a motion. And is there someone that can wave to me that they'll do that motion for me? I'm looking. How about Francis?
I don't really have that up on my board docs. I haven't been able to get it up this morning.
Okay. All right. Thank you, Francis. David will. Thank you.
Hello, hello.
Yes.
Okay. Move to approve the differentiated essential competencies DECs of graduates of Texas nursing programs evidenced by knowledge, clinical judgments, and behaviors, January 2021, as indicated in attachment C.
Thank you. And can someone wave for me that you'll give me a second? Maisie? Okay. Can you say that, Maisie? I can't hear you.
Second the motion.
Okay, great. So we have a motion and a second. If they're in, and Dr. Edwards is back, I'm going to take a vote if there's no other discussion. Dr. Edwards?
This is Allison Porter Edwards voting yay.
Okay. Laura Disk?
Laura Disk, 4.
Carol Hawkins? I can't hear you, Carol. I still cannot hear you. I still cannot hear you. So if you want to give me a yes sign, okay. And so I'm visualizing Carol Hawkins with a yes. Kathy Lederhorn?
Kathy Lederhorn, yes.
Maisie Jameson?
Maisie Jameson, yes.
David Saucedo?
David Salcedo, yes.
Melissa Scott?
Melissa Scott, 4.
Francis Stokes?
Francis Stokes, 4.
Excuse me. Rick Williams?
Rick Williams, 4.
Kim Wright?
Kim Wright, 4.
And myself, Kathy Shipp. So the motion carries. Exciting to have this new document. Thank you. Next on the agenda is item 7.31.
Good morning,
and
Madam.
it is, yes. What?
Go ahead.
Okay, 7.3.1, review and consideration of current position statements without changes. Elise McDermott?
Yes, I got really excited about the position statements. So I'm Elise McDermott. Good morning, Madam President and board members. So this is agenda item 7.3.1. So I just wanted to notice that I will be talking about 2 separate board reports. This one is review and consideration of position statements without changes, and the other one is going to be with changes. We wanted to make it very, very noticeable to nurses, stakeholders, that there are many that we did not make any changes, especially with everything that's going on in nursing practice and COVID. We wanted to make it very apparent those that did not have changes and separate those from the ones that did have changes. As a reminder, board position statements do not have the force of law. They are more guidance for nurses on different issues in practice that come up frequently. We, as board staff, review these annually and bring them each year to the January board meeting. Any changes that we would be making would be based on evidence-based practice developments, any guideline changes, or any regulation movements. As you will see in this specific board report, these position statements did not have changes. Therefore, they were all hyperlinked, and board staff would like to see that there be, these would be accepted without any changes, but any allowance for any non-substantive word or hyperlink changes. as the year goes on, some of our hyperlinks break, or we might change the name of a resource that's linked in there. So it'd be just for those simple changes, no substantive changes. Does anyone have any questions?
Any questions, board members? Okay. Macy Jameson, can you give me a motion for agenda 7.3.1?
Yes, Madam President. I move to adopt the current board position statements with changes along with allowance for non-substantive word and hyperlink editing for purposes of clarity as may be deemed necessary by board staff.
Okay, thank you. And in that motion, there was a break in the sound, and so the statement was without any recommended changes, correct? Ms. Jameson, you said without any?
Sorry.
Okay, well, it's part of the transmission, so, okay. Great. So could I have a second for that motion?
I'll second.
Who was that? Francis? Okay, great. Thank you. Having a motion and a second, we'll now take an oral vote. Dr. Edwards? Okay, she is, Dr. Edwards? Her visual is not there. We'll come back. Laura Disk?
Laura Disk, 4.
Okay, Laura Disk?
Laura Disk, 4.
Okay. Dr.
Can you hear
Edwards?
me?
Yes, now, yes. Dr. Edwards?
Can you hear me?
Yes, I can hear you, Dr. Edwards. I'm asking for your vote. Okay, I think we're still having some problems. Okay, Carol Hawkins? Okay, and so I've just lost her. Oh, there, Carol Hawkins. She's having trouble with her sound, so I'll go back to her. Kathy Lederhorn.
Kathy Lederhorn, 4.
Maisie Jameson.
Maisie Jameson, 4.
David Saucedo.
This is David Saucedo, 4.
Melissa Scott.
Melissa Scott, 4.
Francis Stokes.
Francis Stokes, 4.
Rick Williams.
Rick Williams, 4.
Okay, I can't hear you. If you.
Allison Edwards, 4.
Okay. Okay, Allison Edwards, 4. Okay, Kim Wright, I'm sorry, she talked over you. Can you tell me again?
Kim Wright, 4.
Great, thank you. And myself, 4. And Carol Hawkins. Okay. I'm not seeing her on here. I'm not sure if oh, okay. Carol, did you say 4? Okay, I guess, Carol, I can't hear you.
Can you hear me now?
Yes,
Okay.
I can.
Carol Hawkins, 4. I'll log out and log back in.
Okay,
Thank you.
great. Okay, I'm sorry, guys. So the motion passes unanimous. Next on the agenda is 7.3.2, review and consideration of current position statements with changes. Ms. McDermott?
Thank you, Madam President. So again, this is the other half of the position statements, or the other portion of the position statements. These are the ones with consideration for current changes. In total, you will see that there are 6 position statements that will have some sort of change. First, we'll talk about the first 4, which will have non-substantive changes. Essentially, each one of these in the 4 that are non-substantive changes Each of these has some references or something in which we use as resources for the basis of these position statements. Those resources or references were updated in 2020, and so we just wanted to bring it to the attention that it does not change the substance, or there's no substantive change to the underlying understanding or intent of our position statement, but instead just to bring reference to the fact that there are new resources. So for position statement 15.2, that's to do with the role of a licensed vocational nurse in the pronouncement of death. Just wanted to highlight that the 2020 American Heart Association guidelines were updated in 2020. That also goes for position statement 15.20 as well. That was also the American Heart Association guidelines update. Position statement 15.29, professional boundaries, including the use of social media by nurses, had a reference to the American Nurses Association social networking privacy toolkit. They now have an entire portion of their website, so just that resource was updated. Last in the non-substantive changes, I do just want to there's going to be a nuance here, so I just kind of wanted to highlight it. So for position statement 15.8, role of the nurse in moderate sedation, there were two references that were updated. One was related to the American Heart Association guidelines for 2020, which is similar to the other position statements. And then the other reference that was updated was the position statement by the Association of Women's Health, Obstetric, and Neonatal Nurses, or AWON. They had a new position statement that was updated in 2020. The actual foundation of their new updated statement does not change anything within position statement 15.8, but it will affect one of our other position statements a little bit differently. But for 15.8, just those two references updated, nothing substantive. So just want to note those four have no substantive changes, non-substantive changes, just the update to the references or resources. Now for our two that will have substantive changes, position statement 15.7, the role of LVNs and RNs in the management and administration of medications via epidural or intrathecal catheters. This is where that nuance will come in. AWON, that position statement from AWON, they did have some new guidance related to pregnant women, laboring women, and the delivery of analgesia or anesthesia by catheters. And they made a very clear statement that it is only within a qualified anesthesia provider's scope of practice to check or verify the correct placement of a catheter, and that registered nurses who are not also licensed as anesthesia providers should monitor but not manage the delivery of the analgesia and anesthesia for those catheter techniques provided to pregnant women. So we did want to highlight that it's now the RN should not be managing that catheter, but monitoring that catheter. And their position statement is hyperlinked in our position statement, and it does kind of outline the differences or the nuances that are new there, but that does change a little bit of our position statement for that population. So that is what is different with 15.7. And as far as 15.6, the board rules associated with alleged patient abandonment, this appears to be the last of the last legislative session changes. And the only thing that really changed here is that position statement does reference safe harbor at one point. So we just added the oral invocation that is allowed after the last legislative session, just to bring all of our resources up to what is consistent with the current board rules. So board staff would recommend adopting these changes, and then also allowing board staff to make any other non-substantive changes such as hyperlinks, as we discussed in the previous board report, that might be needed to be updated throughout the year. Anyone have any questions?
Any questions, board members? Okay, Kathy Lederhorn, could I have a motion on 7.3.2?
Yes, you can. This is Kathy Lederhorn, and I move to adopt the current board position statements with changes, along with allowance for non-substantive word and hyperlink editing for purposes of clarity as may be deemed necessary by board staff.
Thank you. And could I have a second, Ms. Disk?
Laura Disk, second.
Thank you. Having a motion and a second, and no other discussion, we'll have an oral vote. Dr. Edwards? Dr. Edwards, I cannot hear you. Oh, it looks like you're coming back in. Dr. Edwards, are you there?
I am here. Sorry, I'm toggling between the Chromebook has horrible audio that y'all distributed, and I seem to be better on my own laptop. So I'm back on my own laptop. Are we taking a vote?
Yes, and this is 7.3.2.
I heard all of the current position statements, the non-substantive changes, and this is Allison Porter Edwards voting for.
Great, thank you. Laura Disk?
Laura Disk 4.
Carol Hawkins? Okay, I cannot hear you. Okay, Carol Hawkins is giving me a thumbs up that she's for. Kathy Lederhorn?
Kathy Lederhorn 4.
Maisie Jamison?
Maisie Jamison 4.
David Saucedo?
David Saucedo 4.
Melissa Scott?
Melissa Scott 4.
Okay, can you say your name before? Did you?
Melissa Scott 4.
4. Thank you. Francis Stokes? I can't hear you.
Stokes 4.
Oh, okay. Great. Rick Williams?
Rick Williams 4.
Kim Wright?
Kim Wright 4.
And myself, Kathy Shep 4. And the motion carries. Thank you. Next, we'll consider items under 8.6 ALJ proposals for decision, agenda item 8.61, consideration of proposal for decision recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate number 220738 issued to Jessica Cozart. So a docket number 507-2028-52. Ms. Abel.
Thank you, Madam President. Board members, this contested case hearing was held at SOA and the respondent represented herself. This case involved several practice issues that were committed in February of 2019 while the respondent was working as a clinical instructor and was being shadowed by a nursing student. And those violations are summarized for you on page 1 of the report. Additionally, the respondent failed to provide proof of the completion of remedial education requirements that were contained in her 2017 board order. After the hearing, the ALJ issued a proposal for decision and recommended a reprimand with stipulations. And staff is recommending the same stipulations that the ALJ recommended. That would include nursing jurisprudence and ethics course, a medication administration course, a documentation course, a critical thinking course, employer notifications, 1 year of direct supervision, 1 year of indirect supervision, prohibitions from working clinical care positions and night shifts for the first year of the order, and then the quarterly employer reports for the duration of the order. And that would be a 2-year order. I'm happy to answer any questions you might have for me.
Any questions, board members? Okay, Ms. Wright, can you give me a motion for 8.6.1?
Okay, I have a question. Usually the motion's written here. It's not on mine.
Okay, board action. Down at the bottom, let's see. Okay, if you bring up where it just says recommended action, move to adopt on the agenda item.
Okay, maybe this is it. In the matter of permanent certification number 220738, issued to Jessica Cozart, docket number. That's not it, is it?
No. Let me see if somebody else has got it. Okay, Macy's got it.
Yes, move to adopt all of the proposed findings of fact, considerations, conclusions of law in the PFD and impose a warning with stipulation against.
Okay, it says, I think it says reprimand.
Okay.
Does yours have reprimand?
That does not have reprimand.
Okay.
Madam President, this is Kathy Lederhorn. I can do the motion.
Okay, great.
Okay, Kathy Lederhorn, and I move to adopt all of the proposed findings of fact and conclusions of law in the PFD and impose a reprimand with stipulation against the respondent's license as set out in the proposed order.
This is Laura
Okay.
Disk, I second.
Okay, great. All right. Thank you so
Madam
much.
President,
Okay, so we have a motion?
Madam
Yes.
President, can you go ahead and clarify the SOA docket number that motion relates to, please?
Yes, we are doing 8.6.1, consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and the board action in the matter of permanent certificate 220738 issued to Jessica Cozart, SOA docket number 507-202852.
Thank you.
And that motion is attached
Right.
to this order.
I think the
Okay.
board members.
Somebody needs to mute. Somebody needs to mute. We have a lot of background noise that we're picking up. Okay, so we have a motion by Kathy Lederhorn and a second by Laura Disk. So having a motion and a second, we'll now take an oral vote. Dr. Edwards? Dr. Edwards, I think you're frozen. Okay. Okay, Dr. Edwards? Okay.
This is Allison Edwards voting yay.
Okay, thank you. Laura Disk?
Laura Disk, 4.
Carol Hawkins? Okay, she's giving me the notice that it's a thumb up for positive. I see her. Carol Hawkins? Kathy Lederhorn?
Kathy Lederhorn, 4.
Maisie Jamison?
Maisie Jamison, 4.
David Saucedo?
David Saucedo, 4.
Melissa Scott?
Melissa Scott, 4.
Francis Stokes?
Francis Stokes, 4.
Rick Williams?
Rick Williams, 4.
Kim Wright?
Kim Wright, 4.
And myself, Kathy Shipp. So the motion passes. So we're really struggling with the technology. When I'm seeing you talk, I'm not hearing. And somebody has to mute your background. Right now, we're picking up. I'm not sure. So it's taking me a minute because I can't tell if I'm going to hear you or not. There's a lag in many of you when you're talking, and then the sound comes. So we'll get through it. Okay, next we will consider agenda item 8.62. Consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate number 830260 issued to Susan Nicole Dembski. SOA docket number 507202653. Gina Abel will present. Thank you.
Thank you, Madam President. Board members, this contested case matter was held at SOA and the respondent was represented by counsel. Following the hearing, the ALJ did find practice violations to include a violation of the respondent's prior TPAP board order, in which the respondent failed to disclose her prescription medication prior to a random drug screen, which is a requirement of the TPAP program. Additionally, the respondent did not timely respond to TPAPN in their request, and she was referred back to the board and dismissed from the TPAPN program. Additionally, the respondent also failed to take precautions to secure a patient's medication and also failed to properly waste the medication according to the facility's policies. And the ALJ recommended a 1-year suspension. You'll note on the first page of your order, staff's recommendation is slightly different. There's a little bit of a nuance there. The ALJ recommended that there be an enforced suspension until the respondent could comply with TPAPN. However, the respondent is no longer in TPAPN and was dismissed from the program. So when that happens, what typically occurs is that the board will issue an enforced suspension until the respondent can show 12 months of sobriety, and then that converts to a probated suspension. But that stays with the board for monitoring and does not get split between the board and TPAPN. So there's a little bit of confusion in the ALJ's recommendation about how that would be implemented. So staff is making the recommendation that there just be the 1-year enforced suspension until there is 12 months of consecutive sobriety shown. Following that, consistent with what the ALJ recommended, there would be a 2-year probated suspension. And during that time period, the respondent would have to conclude or complete a nursing jurisprudence and ethics course, a medication administration course, a documentation course, and a critical thinking course. Additionally, there would be the employer notifications that would be required, indirect supervision for the duration of the order, quarterly reports, and abstention and drug testing. And you'll note in your packet that the respondent did include a submission for your consideration concerning the proposed sanction. I would point out specifically for your consideration that the ALJ in this case found that there was no evidence produced at trial of any mitigating factors, and that is on page 17 of the PFD. And I'm happy to answer any questions that you might have for me.
Board members, do you have any questions of Ms. Abel or any comments? Okay, someone that has the item up, could you please raise your hand for giving me, David, thank you. Okay, David is going to give me a motion on 8.6.2.
Yes, ma'am. Madam President, we move to adopt all of the proposed findings of fact and conclusions of law in the PFD and impose an enforced suspension against the respondent's license, followed by a 2-year probated probationary period as it sets out in the attached proposed order.
Thank you. So I have a motion. So Ms. Scott, do I have a second?
Scott, and I second.
Thank you. So I have a motion and a second. We'll now take an oral vote. Dr. Edwards?
Hear me?
Okay.
Can you hear me?
Yes.
This is Allison Edwards voting yay. And just to let you know, the muting and unmuting process, because of the significant delay, is crazy. I can more quickly vote electronically. Is there not any way that we could, that Madam President could read everybody's vote so the public would know how you voted? vote away in this mute unmute process.
Okay,
I'm not sure.
Madam President, this is Patricia.
Yes.
So through board docs, when we call the vote, I am still sending it out through board docs, and board members that are logged into board docs can see the vote coming up, and it is registering here on my screen. I see that Allison, Laura, Kathy Lederhorn, Maisie, Melissa Scott, Carol Hawkins, and Rick Williams have all voted on board docs. I can, if you want to call their name as I see the vote come up on the screen, I can tell you what their vote is, if that would help simplify the process. Although I'm not sure, I would have to rely on the general counsel's opinion on whether or not that is acceptable.
You know, it hasn't been coming up on mine. So this is the first time I'm seeing where I could vote. And I haven't seen a consensus afterwards either.
Right. I don't believe it's going to show you the results. It will only show it to me on my, I have a secondary laptop over here that is specifically
Okay.
for board docs only,
Okay.
that I'm running the meeting from.
Okay. So we have 1, 2, 3, 4, 5, 6. We need to get through this vote.
Okay.
So let's see if we do. I've got Allison's for this, and then I guess Dusty, we can talk about it. Okay, Laura Disk,
Laura Disk 4.
Carol Hawkins,
Carol Hawkins, 4.
Kathy Lederhorn,
Kathy Lederhorn, 4.
Maisie Jamison, Maisie Jamison. Okay, I'm not hearing you. Okay, I can see you're saying Maisie Jamison. Do you want to give me a thumbs up? I think you said 4. Okay. David Salcedo,
This is David Salcedo 4. Thank you.
Melissa Scott,
Scott, 4.
Francis Stokes,
Francis Stokes, 4.
Rick Williams,
Rick Williams, 4.
Kim Wright,
Kim Wright, 4.
and myself, Kathy Shipp. So the motion passes. So we have 1, 2, 3, 4, 5, 6, 7, 7 more to vote. So Dusty, do you have opinion for us?
Yeah, I think I do. I'm not sure what Dr. Edwards was suggesting. Obviously, she has some serious technical difficulties on related to her connection to the board. I think I would not recommend changing procedural patterns at this point. I think that what we have seen is a sort of a most of the board members are able to either say yay or thumbs up means yes, or thumbs up means for the vote. I think to the extent that if you're having trouble with your mute or unmute, that I believe is, Madam President, you should acknowledge, as you have before, that the thumbs up is a for vote. To the extent that the board members have not had any trouble unmuting and verbalizing their for or against vote, I say we sort of go forward, and if a board member is sort of doesn't want to use the mute or unmute, then they should give a thumbs up for a for vote or a thumbs up for a no vote, and that you can acknowledge that while this board meeting's being recorded as to what you see and what their vote is. And then of course there's a backup, because Patricia, to the extent that the board docs is allowing for a electronic submission to be recorded. That'll be the backup of the vote too. That's kind of how I see it.
Dusty, would it be okay after she calls the vote if she needs clarification, if I tell her what the vote is according to board docs? If I read the votes out according to board docs?
Sure.
Would that possibly help? Because if Allison cuts out in her vote or another board member, I can look in board docs and it will tell me.
Yeah, that's okay, but that board docs isn't, I think we're recording this, and the idea is that it's visualized for the public as to what's happening. You're not going to substitute what you're reading for what we're seeing on the screen. I believe that we have to have a majority vote from a quorum as displayed on this WebEx
Okay.
broadcast.
So it's Dr. Edwards and Carol Hawkins are the two that I've had more trouble with. And then there's some delays, but I'm getting delays from several people, but I'm watching for it. So, okay, let's move on. And what I'm thinking is we will finish these and then we will take a lunch break and come back for our executive session and the final miscellaneous items under 9. Item 9. Or board members, are you good with that? Okay, everybody's kind of shaking their heads. Okay, all right. Next, we'll consider agenda item 8.6.3, consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate number 227048 issued to Stella Viola Aguilide, aka Stella Viola Cunningham. SOA docket number 507202122. Ms. Abel?
Thank you, Madam President. Board members, this contested case hearing occurred at SOA and the respondent represented herself. Following the hearing, the ALJ found that the respondent committed some practice violations when she became aware of a patient's high blood pressure, but delayed in notifying the physician herself, and instead tried to utilize the chain of command for several hours before the physician could finally be notified. The ALJ recommended a warning with stipulations, and you'll note that the recommendation does not include any type of supervised practice. Staff agrees with that recommendation and is recommending a warning with stipulations to include a nursing jurisprudence and ethics course and a critical thinking course. Specifically, if you look on page 5 of the PFD, the ALJ does include in the analysis the reasons why the ALJ believes that the evidence does not support supervised practice, and because there are specific findings that the evidence does not support that type of stipulation, staff is recommending that you adopt the recommendation of the ALJ without any changes. And I'm happy to answer any questions if you have any for me.
Any questions, board members? Okay, Melissa Scott, can you give me a motion on agenda item 8.6.3?
Yes, Madam President. This is Melissa Scott, and I move to adopt all of the proposed findings of fact and conclusions of law in the PFD and impose a warning with stipulations against the respondent's license as is set out in the attached proposed order.
Okay.
I second.
Largest. Okay, so I have a motion and a second, and we will, if there's no other discussion, we will now vote. So, Dr. Edwards. So she's voting yes, and I am visualizing her. Thank you. Laura Disk.
Laura Disk, 4.
Carol Hawkins.
Carol Hawkins, 4.
Kathy Lederhorn.
Kathy Lederhorn, 4.
Maisie Jamison.
Maisie Jamison, 4.
David Salcedo,
Salcedo, 4.
Melissa Scott,
Melissa Scott, 4.
Francis Stokes,
Francis Stokes, 4.
Rick Williams,
Rick Williams, 4.
Kim Wright,
Kim Wright, 4.
and myself, Kathy Shipp. So the motion on 4 and it passes. Next on the agenda is 8.6.4, consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate number 142668 issued to Cleo Lynn Fredericks, SOA docket number 507-202475. Ms. Abel?
Thank you, Madam President. Board members, this contested case hearing occurred at SOA and the respondent represented herself. This involves a 2019 California Board of Nursing revocation order. And following the hearing, the ALJ found that the board was authorized to take action based on that revocation order from California. The ALJ recommended also revocation in this case. The ALJ included a pretty substantial analysis of the action taken by the California board and the PFD. This was not a default PFD. The respondent did appear and defend herself in front of an ALJ in the California courts, and the California board did adopt the ALJ's recommendation there also. I'd also just point out the discussion of the aggravation that the ALJ includes in the PFD, and that occurs starting on page 5 of the PFD, and then continuing on to page 8. And so based on the discussion in the PFD, the staff is also recommending the recommended sanction of revocation. And I'm happy to answer any questions you might have for me about that.
Any questions, board members? Okay, Ms. Disk, can you give me a motion for 8.6.4?
So, Madam President, I move to adopt all of the proposed findings of fact and conclusions of law in the PFD and revoke the respondent's license as is set out in the attached proposed order.
Okay, and Kathy Lederhorn, can you give me a second to the
Kathy
motion?
Lederhorn, I second the motion.
Okay, we have a motion and a second, and we will now take a vote. Dr. Edwards, can you hear me? Your video is not on. Okay, we'll go to Laura Disk.
Laura Disk, 4.
Carol Hawkins.
Carol Hawkins, 4.
Kathy Lederhorn.
Kathy Lederhorn, 4.
Maisie Jamison.
Maisie Jamison, 4.
David Salcedo.
4.
Melissa Scott.
Melissa Scott, 4.
Francis Stokes.
Francis Stokes, 4.
Rick Williams.
Rick Williams, 4.
Kim Wright.
Kim Wright, 4.
And myself, Kathy Shipp, 4. And the motion carries. Next is the agenda item 8.6.5. Consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate number 307861 issued to Joseph Wayne Keenum, SOA docket number 507-201528. Ms. Abel.
Thank you, Madam President. Board members, this contested case was held at the State Office of Administrative Hearings, and the respondent represented himself. The ALJ did find violations of the Nursing Practice Act. Specifically, there were errors in the patient's medical records either indicating that the medications that were documented as administered were in fact not, or if they were in fact documented correctly, the respondent went back later and made 2 incident reports that were then false. Either way, the ALJ specifically noted that these constituted violations of the Nursing Practice Act with regard to documentation, and that it called into question the respondent's ability to maintain accurate documentation. The respondent provided a very lengthy response, which is included in your packet. There are several exhibits included as well as a narrative. I would like to point out that the information that is contained in your packet was also provided by the respondent at trial. And the ALJ in this case also left the record open to allow the respondent to file additional information. And all of that is the same information that is included in your packet. Of course, evidence that's presented at trial is what can be considered as part of the administrative record in this case. And all of the evidentiary issues concerning those documents were handled by the ALJ at the time of trial. And any consideration of documents that were outside the record would be inappropriate for the board to consider. The ALJ did recommend a warning with stipulations in this case for 1 year. Staff is recommending the same sanction, a warning with stipulations, to include a nursing jurisprudence and ethics course, a medication administration course, a critical thinking course, a documentation course, employer notifications, 1 year of indirect supervision, and quarterly employer reports. And I'm happy to answer any questions if you have them.
Thank you, Ms. Abel. I'm trying to see. Can someone raise their hand to give me a motion on 8.6.5? Okay, Maisie.
This is Maisie Jameson. Move to adopt all of the proposed findings of fact and conclusions of law in the PFD and impose a warning with stipulations against the respondent's license as is set out in the attached proposed order.
Thank you. This is Allison. Who? Somebody gave me a second?
Allison.
Okay. Dr. Edwards. Okay, so we have a motion and a second. So having a motion and a second, we'll now take an oral vote. Dr. Edwards? Okay. Dr. Edwards? Dr. Edwards? Okay, I'm getting the motion that she says yes. We're having a delay. Thank you. Laura Disk?
Laura Disk, 4.
Carol Hawkins?
Carol Hawkins, 4.
Kathy Lederhorn?
Kathy Lederhorn, 4.
Maisie Jameson?
Maisie Jameson, 4.
David Saucedo?
David Saucedo, 4.
Melissa Scott?
Melissa Scott, 4.
Francis Stokes?
Francis Stokes, 4.
Rick Williams?
Rick Williams, 4.
Kim Wright?
Kim Wright, 4.
And myself, Kathy Shipp, is 4, and the motion passes. Now we'll go to 8.6.6. Consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate 883856 issued to Shim Magosi Kenyana, SOA docket number 507-202804. Ms. Abel.
Thank you, Madam President. Board members, this contested case matter occurred at SOA and the respondent was represented by counsel. The ALJ did find that in January of 2019, The respondent failed to intervene on behalf of a patient, and the patient died 5 hours into the respondent's shift, and there's very little evidence in the record that during that time, the respondent intervened on behalf of the patient. The ALJ following the hearing did recommend a reprimand with stipulations to include the stipulations that are set out on page 1 of your report. I would also point out that the respondent did submit a submission for your consideration, which has been included in your board materials. Just as to point out to you, in the PFD, the ALJ did specifically include reasons why supervisory requirements should be imposed in this case, and that is on page 15. Staff agrees with the reasoning and the analysis that's included in the PFD and is recommending a reprimand with stipulations for 2 years to include a nursing jurisprudence and ethics course, a physical assessment course, a critical thinking course, employer notifications, 1 year of direct supervision, 1 year of indirect supervision, and quarterly employer reports. And I'm happy to answer any questions if there are any from you.
Any questions, members? Okay, Mr. Salcedo, can you give me a motion on 8.6.6?
Yes, ma'am. We move to adopt all of the proposed findings of fact and conclusions of law in the PFD and impose a reprimand with stipulations against the respondent's license as set out in the attached proposed order.
And Mr. Stokes, can you give me a second?
Francis Stokes, second.
Thank you. Having a motion and a second, we will now take a oral vote. Dr. Edwards? Okay, I'm having trouble with her visual, so I'll go on to Laura Disk.
Laura Disk, 4.
Okay, and I see Dr. Edwards is giving me a 4. Carol Hawkins.
Carol Hawkins, 4.
Kathy Lederhorn.
Kathy Lederhorn, 4.
Maisie Jamison.
Maisie Jamison, 4.
David Salcedo.
4.
Melissa Scott.
Melissa Scott, 4.
Francis Stokes.
Francis Stokes, 4.
Rick Williams.
Rick Williams, 4.
Kim Wright.
Kim Wright, 4.
And myself, Kathy Ship, 4, and the motion passes. Next, we will consider agenda item 8.6.7. Consideration of proposal for decision recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate number 622162 issued to Kefalet et Totoro Long, SOA docket number 507192766. Ms. Abel?
Thank you, Madam President. Board members, this contested case hearing was held at SOA and the respondent was represented by counsel. Following the hearing, the ALJ did find practice violations committed by the respondent to include a failure to have the patient transferred to a telemetry unit after having an elevated CWA score, and also restraining the wrist of 2 patients without a physician's order or medical necessity. And following the hearing, the ALJ recommended a warning with stipulations. Staff is also recommending that same sanction level, also to include a nursing jurisprudence and ethics course, a critical thinking course, a documentation course, employer notifications, indirect supervision, and quarterly employer reporting. I'd also point out that the respondent did include a submission for your consideration, which was included in your packet. And I'd also point out for your consideration that the ALJ did discuss aggravation and mitigation factors and the need for supervision on page 17 of the PFD. And I'm happy to answer any questions you might have for me.
Thank you. Any questions or statements, board members? Okay, Melissa Scott, could I get a motion on agenda item 8.6.7?
Yes, Madam President. I am Melissa Scott, and I move to adopt all of the proposed findings of fact and conclusions of law in the PFD and impose a warning with stipulations against the respondent's license as is set out in the attached proposed order.
Thank you. And Kim Wright, can you give me a second?
Yes, Madam President, I second.
And that was Kim Wright. Okay, have a motion and a second. We will now take an oral vote. Dr. Edwards? Okay, she's not in her, I'm not viewing her. Excuse me. Laura Disk?
Laura Disk, 4.
Carol Hawkins?
Carol Hawkins, 4.
Kathy Lederhorn?
Kathy Lederhorn, 4.
Macy Jamison?
Maisie Jamison, 4.
And Dr. Edwards just gave me a thumbs up. I saw her visually. David says
Settle 4.
Melissa Scott?
Melissa Scott, 4.
Francis Stokes?
Francis Stokes, 4.
Rick Williams?
Rick Williams, 4.
Kim Wright?
Kim Wright, 4.
And myself, Kathy Shipp, is 4. And the motion passes. Next week, we'll consider agenda item 8.6.8. Consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate number 909235 issued to Hajur Natamar at SOA docket number 507-201439. Ms. Abel?
Thank you, Madam President. Board members, this contested case matter occurred at SOA, and the respondent was represented by counsel. Following the hearing, the ALJ did determine that there was another order issued by the Michigan Board of Nursing in July of 2018 that resulted in discipline on the respondent's license in Michigan. And there were several practice violations that contributed to that order that are set forth on page 1 of your report. And the ALJ did find that and recommended a warning with stipulations to be imposed against the respondent. The ALJ did include in the PFD a discussion of the Michigan order and that would be a similar sanction to what was required by Michigan. Staff is also recommending a warning with stipulations to include a nursing jurisprudence and ethics course, employer notifications, 1 year of indirect supervision, and quarterly employer reporting. And I am happy to answer any questions. I would point out that the respondent did include a submission for your consideration, which has been included in your packet. And the discussion by the ALJ regarding aggravating and mitigating factors can be found on page 5 of the PFD for your reference.
Okay, thank you, Ms. Abel.
Oh, this is Kathy Lederhorn. Miss Abel, I just had a quick question. It says when I was reading that the respondent had completed the Michigan order, and so they were completed with that whole entire order, and then we added on, or are we continuing their order? I was just confused.
So this would not be, the order that you would be entering would be an order, a Texas order, a new order in Texas, based on the fact that there was another issue in another state. So that's one of the separate reasons that the board is authorized to issue discipline against a licensee, which is the statute that's cited there under 301.452B8. So this doesn't have anything to do with the Michigan order. It doesn't change the terms of that order. That's for that state to deal with, you know, and we deal with our orders. This is just discipline based on there being other issues in another state to make sure that this person's safe to practice in Texas.
Okay. Are you good? Okay.
Yes, I'm so sorry. Thank you. Yes.
Okay, thank you. Mr. Williams, can you give me a motion on 8.6.8? I cannot hear you.
How about now?
Yes.
Okay, thank you.
Mhm.
Madam President, move to adopt all of the proposed findings of fact and conclusions of law in the PFD and impose a warning with stipulations against the respondent's license as is set out in the attached proposed order.
Thank you. Thank you. Ms. Jamison, can you give me a second?
This is Maisie Jamison. I second.
Okay, having a motion and a second. If there's no other discussion, we'll now take an oral vote. Okay, Dr. Edwards has her finger up. So I'm visualizing a yes. Laura Disk,
Laura Disk, 4.
Carol Hawkins,
Carol Hawkins, 4.
Kathy Lederhorn,
Kathy Lederhorn, 4.
Maisie Jamison,
Maisie Jamison, 4.
David Saucedo,
It's Salcedo, 4.
Melissa Scott,
Melissa Scott, 4.
Francis Stokes,
Francis Stokes, 4.
Rick Williams,
Rick Williams, 4.
Kim Wright,
Kim Wright, 4.
and myself, Kathy Shipp, passes. So 4. Next, we will consider agenda item 8.6.9, consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate number 227266, issued to David Gentry Sanders, SOA docket number 507-204384. Ms. Abel.
Thank you, Madam President. Board members, this contested case hearing occurred at SOA and the respondent represented himself. Following the hearing, the ALJ found that the respondent failed to implement physician orders timely while working the weekend shift and delayed administration of 2 medications for the patient until Monday morning. That occurred in April of 2019. The ALJ recommended a warning with stipulations, which is also what staff is recommending, and that would include a nursing jurisprudence and ethics course, employer notifications, 1 year of indirect supervision, and quarterly employer reporting for 1 year. And I'm happy to answer any questions if there are any for me.
Any questions, board members? Okay. So Ms. Disk, can you give me a motion?
Madam President, I move to adopt all of the proposed findings of fact and conclusions of law in the PFD and impose a warning with stipulations against the respondent's license as is set out in the attached proposed order.
Mr. Stokes, can you give me a second?
Francis Stokes, second.
Great, thank you. Having a motion and a second, we'll now take an oral vote. Okay, I see Dr. Edwards. I'm visualizing her thumbs up. Laura Disk,
Laura Disk, 4.
Carol Hawkins,
Carol Hawkins, 4.
Kathy Lederhorn,
Kathy Lederhorn, 4.
Maisie Jamison. Okay, Maisie Jamison is giving me a visual that her thumb is up. David Saucedo,
David Salcedo, 4.
Melissa Scott,
Melissa Scott, 4.
Francis Stokes,
Francis Stokes, 4.
Rick Williams,
Rick Williams, 4.
Kim Wright,
Kim Wright, 4.
and myself, Kathy Shipp, 4, and the motion passes. Hey, thank you, Ms. Abel, for all of those cases, and you and your staff and Dusty for our legal team. Thank you very much, and all of these orders that we have, and Tony, your investigators. So,
Madam President,
Yes,
before we go to break, could we go ahead and take care of agenda item 9.1 for the purposes of the recording.
Sure. Okay, everybody's gone. Okay, now that they're all back.
Yeah.
Okay. So now we'll move to 9.1, review of the board quarterly meeting evaluation. So last time, you know, we were virtual and I only got 5 in, and I can't remember who was missing. I don't think we had everybody there. But basically, again, in going over this checklist, the agenda was clear, supported by necessary documents, circulated sufficient time before the meeting, and the suggestions for improvement. I really like to say these because it usually has to do with the good job our staff is doing. So it says, as always, staff does an incredible job, and thank you, Patricia. So she just keeps us on track. And were the members prepared to discuss? And the statement, our members are always prepared and knowledgeable about materials to be discussed. So I appreciate the fact that I know you spend a lot of time getting ready for the meeting and that you're prepared on the items. Reports were clear and contained needed information. And the statement is reports are consistently clear and concise. Number 4, avoided getting into administrative management details, and the suggestion or statement, virtual went well. So we're getting better. We've had a little struggle today, but it seems like every time just a little bit, not a lot. Nothing changed on diversity. The chair guided the meeting, no statements. Future issues were identified. Patricia and staff continue to do well with virtual format, was the statement. All members were present, that we had a quorum, so I'm not sure how many we had last time. I don't have that here. The meeting began and ended on time, so still okay. Meeting room, so virtual setup was good, excellent support. Miscellaneous suggestions. Virtual background should be professional. This was my first WebEx board meeting. In my opinion, it went very well, that a board member said. The technical issues were minimal and did not delay the meeting. Next statement by a board member, I do have a few recommendations as speakers to speak clearly into their microphone, no mask if possible. Have speakers that are participating stay on video. Board members stay on video. Board staff is always very organized and meeting runs smoothly. Reinforce time limit on public presenters. You know, last time we had some presenters and schools, I think. Reinforce time, okay. And then IT issues, so was in and out some, overall went very well. So I think it's still real positive. I think we're still working on this virtual format. Did anybody have anything else to add last time? Since I only had 5 to come back from members. Nothing? Okay. All right. So after today, I guess, will you send that out to Patricia? Will you send the evaluation out and they can email them back to me?
Yes, ma'am. It's already been sent in PDF format and in Word format for whichever is easier for the board members.
Okay. And then they can send back to me. You've got my email. Everybody's got my email. Okay. All right. So this is the first time we've done this about our evaluation. So for the audience, every year, Kathy Thomas evaluates herself through specific questions, and then we, as a board, evaluate her as well. And she is basically, our 13 board members for an organizational chart are at the top, and Kathy is our one employee as board members, and we're appointed to 6-year terms by Governor Abbott. And so our job is to work with Kathy, how she works this state agency, the Board of Nursing. And so then we as a board evaluate ourselves. And so this is always, we've done this, and now we will go into executive session and discuss these things, and then we will come out of those if we have any motions. So, and since we haven't done this virtual before, how do we do this, Patricia?
Madam President, this is Catherine Thomas. I have a
Okay.
quick question. Are you going to break for lunch as you announced earlier, or are you going straight into executive session?
Oh, that is true. I did say that. So I guess it's up to board members. Do you want like about a 10 or 15-minute break? Or do you want a bigger lunch break? Allison, what are you?
I would like a break.
Okay.
I think if everybody's in agreement, if we could get a little something to eat, maybe 30 minutes.
Okay. Okay. Are y'all good with that? Okay. So right now I have that it's 12:12. So we'll do like 12:15 to 12:45. Come back at 12:45.
Thank you.
We're good with that? And so then at 12:45, we'll come back and open up the meeting, and then we'll go into executive session. So for those that are the audience, there won't be really any meeting details other than going into executive session. And we really don't know how long executive session will take. Probably at least 30 minutes to, or longer. So any suggestions, Ms. Thomas?
No, ma'am. I think 30 minutes to an hour might be the time it takes you all normally to do these two executive sessions. But as you said, you'll come back into meeting and then announce what you're going to discuss in executive session.
Okay.
So at 12:45.
Okay, so we'll see everybody back at 12:45. Thank you.
Thank you.
Okay, hello, welcome back to our board meeting. We were having a little IT issues. I'm sorry, we're just a few minutes behind. And it is now 12:53. And we will be looking at 9.2 executive session pursuant to Texas Government Code. And, oh, goodness, hard to see for me. 551.074 Texas Open Meeting Act regarding personnel matters, annual performance evaluation of Catherine A. Thomas, MN, RN, FAAN, Executive Director. And we're going to go into closed session. Also during this time, we will be doing 9.3 executive session pursuant to Texas Government Code and 551.074 Texas Open Meeting Act regarding personnel matters annual board self-evaluation. So the Vice President, Dr. Edwards, and myself will be having this meeting, and she will be conducting these two evaluations. So at this time, we will go into closed meeting, and I think we probably, hopefully we'll be back by 2, about 5 till 2 now. So Patricia, our administrative assistant, and there will be no staff in the room. now back in open meeting, and we will consider action on agenda item 9.2, annual performance evaluation. Catherine A. Thomas, MN, RN, FAAN, Executive Director, and it was 139. So our Vice President, Dr. Edwards, will call for a motion.
So the board discussed the most we could do for Ms. Thomas and discussed administrative leave, and Francis Stokes agreed to make the motion regarding award of 10 administrative leave days for 2021-2022 for past exemplary performance. So Francis, you're muted. Can you unmute or turn up volume?
Yeah, that'd be better, I guess, wouldn't it?
Thank you.
Madam Chairman, I move to award the Executive Director, Catherine A. Thomas, MN, RN, FAAN, 80 hours of administrative leave time due to the exceptional work as Executive Director of the Texas Board of Nursing.
Okay. Allison?
May I have a second? We couldn't hear you, Maisie.
This is Maisie Jamison. I second the motion.
Okay,
Now
I'm
we'll
gonna
call for a vote.
yes.
You'll conduct the vote, Madam President?
Yes. Okay, Dr. Edwards?
Yay.
And Laura Disk?
Laura Disk, 4.
Carol Hawkins?
Carol Hawkins, 4.
Kathy Lederhorn?
Kathy Lederhorn, 4.
Maisie Jamison?
Maisie Jamison, 4.
David Saucedo?
David Salcedo, 4.
Melissa Scott?
Melissa Scott, 4.
Francis Stokes?
Francis Stokes, 4.
Rick Williams?
Rick Williams, 4.
Kim Wright?
Kim Wright, 4.
And Kathy Ship, myself, 4. And the motion passes. So congratulations, Ms. Thomas. We appreciate all the work you've done and your service to us, and hope that you can enjoy a little bit of time off.
Thank you very much. I appreciate it.
And then in the near future, myself and the Vice President will meet with you just to discuss the evaluation a little further. So, Dr. Edwards, do you want to go with the final agenda there? We cannot hear you.
Yes, ma'am. So our final agenda item was the annual evaluation, point 3, which we discussed each of the questions and the board's self-evaluation. And the only discussion is a non-voting item, but we did determine that question 9 should be reworded to be in a positive frame of light. So rather than saying, as question 9 is currently worded, does not intervene with the executive director's operational policies, we'd like to say, and then it relates, recognizing that low trust results in more control. We'd like to have reword that to reflect more positivity, where we would say that that high trust in the executive director results in less intervention of the executive director's operational policies. So we talked about rewording that because and the reason we wanted to reword that is because it appears as though we have one, if not two people that may have misinterpreted that and marked it as not at all. So like maybe with the rewording. So non-voting item, just a recommendation for the future.
Yeah, we just thought that would make it a little more clarity to what the intent of the question was. Okay. So, great. Okay. Thank you, Dr. Edwards. So is there anything else that we need to cover or anything, Ms. Thomas, that you think we need to do? Or
No, ma'am, you have completed the agenda.
Okay. Well, just to say that this may be the last time we'll have Francis Stokes with us. He's been with us for 6 years. He's going off his term. This is probably his last meeting, and we discussed that in ours that we're going to miss him, and we've appreciated having his input and him being part of our board and team, and
It's been my pleasure.
we've loved it.
Thank you, Francis.
Yes.
So Francis, you are awesome.
Yes, yes. So anyone going to the coast, we have to look him up in Port A. So, is there anything else we need to cover? Anything? So, if not, get my time here. The board members and staff have completed all the items on the agenda, and I'm adjourning the January 21, 2021 meeting, and the time is 1:47. Thank you all.
Thank
See
you
you
for guiding our ship.
Thank you, Kathy. Y'all take care.
Bye.
Bye.
Bye.